From the outset of this pandemic, we were all asked to make sacrifices. And this period has been hard on all of us. But it's been especially difficult, it's been especially unbearable for families with loved ones in our long-term care system, retirement homes, and other congregate care settings. And at the outset of this pandemic, we had to make difficult decisions to limit outside visitors to these homes because keeping COVID out of these settings was our best line of defense. And I know how hard this was on families. Trust me, I know. I know the tremendous toll this has taken on people, not being able to see your loved ones. And for many families, not being able to be by the side of their loved ones in the final or most difficult moments is heartbreaking. It's hard to imagine anything worse. And it was a tremendous sacrifice. And we must never forget what these families had to go through. But looking back now, looking back on the devastation this virus caused in the homes that were hardest hit, I know this difficult decision was necessary. Because of the steps we all took, we've been able to keep the vast majority of homes outbreak-free. This decision, as hard as it was the right decision. Together, we have saved countless lives. And I'm so grateful to all of the families who've worked with us. I'm forever grateful to everyone who listened. Your sacrifice will not be forgotten. From the bottom of my heart, I thank you, and I thank all the families. As a province, we have risen to the occasion. We have met the challenge head on. And as a result of everyone working together, as a result of our collective efforts, as a result of our collective sacrifices, today we're able to take an important step forward. Today we're announcing a cautious restart of visits starting on June the 18th to long-term care homes, retirement homes, group homes, and other congregate living settings that are not currently in outbreak. We need families to be able to see their loved ones. And today, we're taking the first steps to help reunite families, to help reunite loved ones in the safest way possible. I know this day we have all been desperately waiting for, but we can't take this progress for granted. We can't forget that these settings are still vulnerable to COVID-19 outbreaks. So we must remain vigilant. We must move forward, but we must do it so carefully. And in the coming days and weeks, we will continue to monitor the situation closely. We're working on expanded visiting opportunities as soon as it is safe to do so. And nothing is more important because we're all in this together. Thank you so much, and God bless the people of Ontario. Now I'll pass it over to Minister Fullerton.
Thank you, Premier. We are seeing the infection numbers stabilize in our long-term care homes, and that is thanks for the tireless efforts of staff, our hospital partners, and the Canadian Armed Forces. Our government's COVID-19 action plan to protect long-term care residents was a driving factor to get to where we are today. Aggressive testing, screening and surveillance, managing outbreaks, and the spread of COVID-19 have resulted in encouraging results in our long-term care homes. In March, we made the difficult decision to restrict visitation at our long-term care homes to essential visitors only. That decision was not made lightly, and I know how much it has affected our loved ones in long-term care, as well as their families. On the advice of the Chief Medical Officer of Health, we have developed a responsible, phased visitation plan that will allow you to visit your loved ones in long-term care and retirement homes that are not in outbreak starting next week. The possibility of spreading COVID-19 into our long-term care homes and retirement homes is still a real threat, so certain conditions must be followed. In consultation with these sectors, we are resuming visitations under the following requirements. For long-term care homes, we are allowing one visitor per resident at a minimum of one visit per week for an outdoor visit only. Retirement homes will have outdoor and indoor visits, with the number of visitors being left to the discretion of the home. To visit, you must have tested negative for COVID-19 in the past 2 weeks, pass an active screening questionnaire, clean your hands when you arrive, and depart with soap and water or alcohol-based sanitizer. Wear a mask and stay in designated areas, and maintain physical distance. Long-term care homes and retirement homes must not be in outbreak. They must maintain the highest infection prevention and control standards and have a system in place to schedule visits and communicate with families, staff, and residents. Our government will continue to work with the hardworking staff in the long-term care homes, our hospital partners, and the Canadian Armed Forces to keep our most vulnerable safe. Thank you. And now I'll pass it over to Minister Smith.
Thanks, Minister Fullerton. Because of each and every one of your efforts to fight the spread of COVID-19, individuals across Ontario will soon be able to have their visits outdoors with their loved ones in congregate care settings. Loved ones and individuals in these settings have been waiting for this day since early March. So thank you for your efforts. Thank you to the families who have been waiting patiently. And thank you to our frontline workers who have done amazing work. They've been working so hard to keep the individuals that they support safe. We'll be allowing 2 visitors per residence in outdoor areas of homes supporting individuals with developmental disabilities, shelters for survivors of gender-based violence, and children's residential settings. Our priority remains the health and safety of residents, workers, and visitors, and that's why, in addition to allowing visitors, we will continue to deliver on our COVID-19 action plan for vulnerable people. This plan laid out measures to stop COVID at the door, contain the spread through infection control, and maintain staffing levels. And we need to continue proceeding cautiously, carefully, and correctly. And that means full adherence to infection prevention and control procedures by both staff and visitors at these settings. Congregate care settings will be responsible for implementing and communicating infection prevention and control protocols to visitors, which include active screening for all visitors, proof of a negative COVID-19 test within the previous 14 days, temperature checks, physical distancing during the visit, mandatory mask wearing, and disinfection of the outdoor area used for the visit. We ask all visitors to please take these guidelines seriously and listen to all the staff on site. They're doing everything they can to protect your loved ones and yourselves. This has been a very difficult time for our province, but it's been especially difficult for those separated from their loved ones, as the Premier mentioned. Today is an important first step in reconnecting these families. Thanks very much.